Assalamu alaikum. The clinical day, Mr. John Adam, 20 years old, referred to your clinic with a history of weakness. Please sit with his brother, Mr. Donald, and address the concern after examining Mr. John. Are you ready, Dr. Najla?
Yes, I am.
Okay, here you go.
Hello.
Hello?
Hi, I'm Dr. Sadiq. I'm one of the doctors working today. Am I speaking to Mr. Donald, Mr. John Adams' brother?
Yeah, doctor, I am.
Yes, hi. So, Mr. Donald, I'm here today to discuss with you about your brother condition and address your concerns, and I'm happy to answer all your questions and concerns by the end of this meeting. I may need to examine Mr. John as well. Is that okay with you?
Sure, doctor.
Okay, thank you very much. So, Mr. Donald, can you please tell me what brought John to the hospital?
Yeah, doctor. John, he's not feeling well for the last couple of months.
Mm-hmm. Mm-hmm.
He's more weaker and getting worse day after day, this weakness. We don't know what's happening with him.
Mm-hmm. Mm-hmm. I'm really sorry for that. It really sounds stressful. It sounds stressful. So, Mr. Donald, can you please tell me how it started? You mentioned it's been 2 months now and it's progressive. How it started?
No, doctor, the weakness worse at the last months, couple of months,
Mm-hmm.
but it started for a long time now, maybe years,
Mm-hmm.
since 2 years now.
Mm-hmm.
And finally, now he's on wheelchair, doctor.
Uh-huh. Uh-huh. Okay. Okay. So you mentioned it had been for a long time. Did you seek any medical advice?
Yes, we sought medical advice, and they told us it's something might be related to the family,
Mm-hmm.
and we don't know what's ongoing, doctor. We
Mm-hmm.
want more clear diagnosis for him.
No, okay. Okay. I'm really sorry for that. So, if you can just tell me exactly where is the weakness is.
All over, doctor, but the most concerning now, standing. He's unable to stand or walk.
Mm-hmm. 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 So he and since when he for the last 2 months he can't walk? Is that what you
Yeah,
say? Yeah. Okay. And what
totally.
about? Yeah. Okay. I'm really sorry. And what about his upper limbs? Yeah, like hands.
Still weak, doctor. He cannot do any hand skills by
Mm-hmm.
his finger.
Mm-hmm. 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 Okay. Okay. And before this started, has Mr. John had any trauma or any fall?
No trauma, doctor, but he fell many times
Mm-hmm.
because according to him, he's feeling unsteady.
Anesthesia.
And yeah, many times we found him on the floor and we,
Mm-hmm.
yeah.
Mm-hmm. Mm-hmm. I'm really sorry for that. And what about eating and drinking? Is he managing well?
So far, yes, he can, doctor.
Mm-hmm. Any talking episodes? Like
Uh,
is he struggling with swallowing food or?
no, he can do that.
Mm-hmm. Okay. Any cough?
No,
Any breathlessness?
no, doctor.
Okay. And when it started, was it started like in his feet first and goes to his legs, or how? If you can just explain a little more, how it started.
Start together, doctor.
Mm-hmm.
No difference in the time.
Uh-huh. Okay. 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 So, is he have he ever had any abnormal movements like seizures or fits?
No,
Okay. Is he diagnosed with any medical condition?
no, doctor.
Never. Is he taking any medications at the moment?
No, doctor.
Is he known to have any hypersensitivity to any medicine?
No, doctor.
Okay. So what about the family history? Anyone in the family has the same condition?
Yeah, doctor. What I hear from my mom that my father had this same weakness at his 50s,
Mm-hmm.
and he's also wheelchair bound, and finally he had a heart attack and he died.
Mm-hmm. Mm-hmm. I'm really sorry for that. Really sorry for that. Okay. Anyone else in the family having the same?
No, doctor.
Okay. So you mentioned he's eating and drinking well. Have he
Mhm.
ever complained from tummy ache?
No.
Is he controlling his bowel movements?
So far, yeah, doctor, but we are helping him.
Okay. And okay. And any cough or chest pain at the moment he mentioned?
No.
No. And what about his water work? Any issues? Is he controlling?
Yeah, it's so far, doctor, but because of an inability to walk,
Yeah.
he's sometimes on a diaper at the bed.
Yeah, yeah, I understand. Okay. And about his lower his limbs, do you feel there is a swelling in the muscles of his legs or
No.
any joints swelling?
No, doctor. Instead, I think it's like very weak.
Very weak. Okay, really sorry. And did you notice any deformity in his feet? Any changes?
I don't know, doctor. Maybe you will tell me.
Yeah, I will examine him. And no skin changes.
No.
Okay. And John has been having this issue for a long time, as I understand
Yeah.
from you. So is he attending a school or anything like that?
He was, doctor, doing fine, but after this general weakness and wheelchair bound, he's unable even to go to his school.
Okay. Is it only because he's not able to
Yeah.
go, or he don't want, or he's having any issue with understanding, or
No, he
just
can understand well, doctor. He's fine with this.
okay. Okay. Is Mr. John is smoking or drinking alcohol?
No, doctor, he cannot.
No. Okay. Okay. Did you notice any, like, did he complaining of the complaint of any high body temperature or night sweats?
No.
Did you notice that his weight changed recently?
Yeah, doctor, he lost some kilograms because of no appetite and he's not eating well.
Okay. Really sorry for that. And how is his mood?
Of course, low mood, doctor, because of his condition and what he can see with his colleagues.
Mm-hmm.
Compared to them, he's not okay, doctor.
Yeah, a kid. Yeah, it's really stressful. And did you notice any? Or he mentioned any lumps or bumps in his body anywhere?
No, doctor.
Okay. Did you notice that he's having any weather preference?
No.
No. Okay. So, what do you think? Is it okay if I examined him?
Yeah, doctor, sure.
Yeah. Okay. Is Mr. John can speak and hear,
Yeah, he can.
and he any issues with his eyesight?
Yes, recently he's saying that he is feeling blurry.
Mm-hmm. 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 Since when did it started?
The last also couple of months.
Okay. And did he mention any headaches?
No,
Okay. Okay. And okay, blurry vision. Uh, do you know, is it on one side, one eye, or both sides?
I
You
don't
don't
know,
know.
doctor.
You don't
No.
know. Okay. So I will. Okay. So, Mr. John, hello. I'm Dr. Siddiq. I'm one of the doctors working today. I would like to examine you if you don't mind, Mr. John.
Yeah, sure, doctor. Go
Okay.
ahead.
So I wanted the full set of observations.
Yeah, blood pressure okay.
Mm-hmm.
110 over 70. Pulse rate is 65.
Mm-hmm.
Temperature is normal, 37.
Mm-hmm.
Saturation is also normal,
Okay.
99 or room air.
Is the blood pressure regular and synchronized?
Yes.
Okay. So I would like to observe his hands, nails, any changes, his palm,
No.
any apparent deformity in the hands.
No.
Okay. I would like to do collapsing pulse. Any?
No.
No.
Good to
Okay.
do, but no.
Okay. So I will check on his eyes. Any pallor, any cyanosis,
No
any
pallor. No
jaundice.
serum. No jaundice.
No jaundice. Okay. I will check on his mouth. Any changes, any features of in his tongue, red tongue, or angular stomatitis, or
No, nothing.
Nothing. Okay, so I will check on. I would like to check on the lymph nodes. Anterior cervical, posterior cervical, all the
No
groups.
lymphadenopathy.
Okay. Thyroid and enlargement.
No goiter.
Okay, so I would like to examine the cranial, the cranial, the lower limbs, CNS lower limbs. So I'll
Okay.
start with the tone,
Yeah. Hypotonia.
hypotonia. Before the tone, any observation, any deformity,
Like what?
Biscavus,
Yeah, he's having Piscavus.
Biscavus. Okay. Any fasciculations.
No fasciculation.
Okay. Wasting apparent.
Yeah, there is wasting.
Okay. So I will go for the tone. You mentioned hypotonia.
Yes.
And what about power? Power around the hip and around the knee.
Weak. All
Weak.
over.
All
Yeah.
over. Okay. Clonus.
Negative.
Okay. And parental reflex.
Down going.
Okay. And reflexes.
Knee reflex, you mean?
Yeah.
Hyporeflexia.
Uh-huh. And the ankle.
The same. Hypo.
Okay.
What you want to do?
Uh, Coordination. If you can just please, Mr.
No,
John,
if you
can you
have hyporeflexia, what you want to do?
reinforcement?
Perfect.
Can you,
Yes.
yeah, can you clench your hands
Yeah.
when I say, yeah?
Still loss. Yeah. Still hypo.
It's still hypo. Okay. So I would like to, can you please, Mr. John, um, move your foot from the knee up to the heel?
He cannot do
Coordination. He
because
cannot
of
do
the weakness. Yeah.
because of weakness. Okay. Okay. So yes. So upper limbs. Again. Any you mentioned no deformity. So tone power.
The same as down. Hypotonia. Hyporeflexia.
Okay. 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 And so he you mentioned Mr. John can't stand, yeah?
Yeah. Yeah. Very
So I
difficult
would
to stand.
yeah, so I would like to do the finger nose test. Mr. John,
Okay.
if you can touch your the front of your chest and my finger, can you do that?
I will try, doctor.
Okay, so
Then
try
you found him is yes, he's fasting. Uh,
pass pointing.
yeah,
Pass pointing. Okay. Can
yeah,
you do your hand like clapping your hand like I'm doing? This the kinesia.
yeah. He cannot do.
I cannot do. Okay, okay. So, Mr. John, I would like to check for the uh, third cranial nerves, eye movement. Can you, do you see, Mr. John?
Yeah,
Visual
right.
field. Mm-hmm.
You check the acuity right eyes, little bit blurred.
Uh-huh. Left,
Okay.
left. Okay.
Mhm.
Okay. Okay. Right affected. So, what about the eye movement?
Yeah, he can move his eyes.
Okay,
No,
and
no double vision, no ophthalmoplegia.
no ophthalmoplegia. And the visual field
Intact. Two
in,
minutes left.
intact both eyes.
Yeah, yeah, both eyes.
So right eye you mentioned affected in which
Acuity only, not fields.
activity? Okay, 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 okay. So Mr. John, what is your concern?
I'm concerned about my brother. Why he's having this weakness, and is it curable thing?
Okay, Mr. Donald, from the what we had, from what we discussed, and from the examination, I believe your brother have a condition called Friedreich's ataxia. It's a medical condition, a medical term for a condition which is
Okay.
he got it like in his genes, like from his parents,
Mm-hmm.
and it causing him this all this deformity and weakness. And I'm sorry to tell you that it is not curable, but we can offer him some help to treat the like to help him with the weakness and to provide support um and to just to improve the quality of his life. Are you following me, Mr. Donald?
Yeah, doctor, is it something might lead to his death like my father?
Actually, Mr. Donald, I'm sorry to tell you that yeah, it might the complication of this condition might shorten his life. I'm really sorry to tell you that, Mr. Donald, but I would like to include a team of specialists in the treatment of Mr. John, just to make, as I mentioned to you, to improve the quality of his life. We would like to run some investigations to find to which extent he is affected, and we'll try to help him
Okay,
to
will he have a heart attack like my father?
he might have a heart attack. Yeah, this condition associated with some it affects the large artery coming out from the heart. So yeah, it might cause a heart attack.
Okay, time is up.
Hmm.
Present your case.
So I examined this gentleman. He's 20 years old, who's having progressive weakness, but he's wheelchair bound for the last 2 months. He's having features in his leg on feature suggestive of Friedrich's ataxia, with blaring vision and in the right eye.
Okay,
Hmm.
what do you think?
So I believe he's having Friedrich's ataxia with mm, um, the visual acuity only affected. I sorry, I can't have an explanation for the blaring
Okay,
vision. Mhm.
okay. What's your differential?
So my differential um, um, combined degeneration of the cord, like vitamin B12 deficiency.
Okay.
Um, but again, is that the cerebellar affection? The patient has
Did
the
did
cerebellar
you ask
affection.
about his diet?
Um, no, no. His brother mentioned he lost some weight and he's having reduced appetite. Yes, I didn't
Okay.
ask about this.
What other differential?
Other differential. What other differential? Mm,
Okay, how you investigate this patient?
so I would like to start with routine investigations, full blood count, checking his hemoglobin and his MCV, the cell size. I would like to do vitamin B12, ferritin, iron level, folic acid level. I would like to do uh, renal function, liver function as well, and I would like to do nerve conduction study and yes, nerve
What's
conduction
your
study
what's your confirmatory test?
for Friedrich's ataxia. Hmm. From confirmatory test. Yeah, genetic testing.
Perfect, yes.
Yeah,
Yeah.
gene. Yeah, fraxine gene.
Okay, do you know the mode of inheritance of this disease?
The mode of inheritance of Friedrich's ataxia. Trinucleotide repeat disorder, I believe.
Yes.
Yeah.
But mainly what? Is it autosomal or X-linked?
I believe it is autosomal recessive. I'm not sure.
Yes, yes.
Yeah. Okay.
The exception of structure disease to be autosomal recessive. Other all structure disease will be autosomal dominant. Okay.
Okay.
And you said there is also trinucleotide repeat
Mm,
disorder, right? Okay.
yes.
Any anticipation?
I believe it's there is anticipation in Friedrich's ataxia. I believe
No, it's not in this. No
really.
anticipation. Yeah, in the
Okay.
Okay. In Huntington and maybe another disease, but Huntington, yes, I'm sure. Okay.
Okay. I'm not sure.
Uh, yeah,
Mm-hmm.
in Huntington there is. Okay,
Mm-hmm.
let's. What happened to his father? What do you think the cause of death of his father?
They usually Died from maybe aortic dissection.
What other cardiac condition you know?
Mm, I'm not sure.
Yes, Hocum might be associated.
Oh,
Why
okay.
is having vision problem?
This is my question. Why he's having vision problem?
Any association, like
Um,
ocular atrophy?
optic atrophy. I'm not sure. I'm not
Yes. Okay.
sure.
What other association? Yes, there is optic atrophy. What other association?
Um, mm,
Hocum and what other disease comes with the Friedreich attacks?
mm, oh, it is
Diabetes.
called mhm.
Diabetes. Okay.
Diabetes. Okay.
Yes, diabetes. How you manage this patient?
So the management of this patient should include a multidisciplinary team,
Okay.
specialized nurse, social worker, physiotherapist, occupational therapist,
Mm-hmm.
and genetic team. And I would like a dietitian as well. Mm, yes, and
Any specific
education
treatment?
for Friedreich's ataxia. I'm not aware of any. We will give like for no. I'm not aware of any specific treatment. No,
No
it's just
specific.
yeah,
Also, you can consider just counseling education about the complication and
education about the condition. Yeah.
yes, if for
Mm-hmm.
example having HOCM, you
Mm-hmm.
have to screen for HOCM, and if there is possibility, you might also interfere with
Yes,
cardiology also with the team, along with the
cardiology
diabetic.
team. Mm-hmm.
Diabetic. Yes.
Mm-hmm. Mm-hmm.
Yes. Thank you, Dr. Najla. Well done. You reached diagnosis, however, you didn't pick up all the finding, but
Yes.
you did it. I think from the characteristic features of lower motor and Biscavus with
Mm-hmm.
family history, I think you don't have a lot of disease with the same presentation.
Mm-hmm.
Charcot-Marie-Tooth only with the same, but Charcot-Marie-Tooth will be mainly as a sensory, sometimes also motor. There is two types.
Mm-hmm. Mm-hmm.
But in Charcot-Marie-Tooth, no as affection of the cerebellum compared to
Yes.
the stellarium.
Mm. I was about to mention it, but I'm just like, is it the
Yeah,
one or not?
no, no,
Yeah.
you can put it in the
Traffic
differential.
management. Okay.
Another thing, the characteristic features of the legs in Charcot-Marie-Tooth, inverted champagne bottle shape, you know it?
Yes. Yeah. Yeah. Yeah.
Yeah.
But he mentioned, yeah, no muscular,
No, yeah,
mm,
yeah. It's
enlargement.
symmetrical, yes, no muscular and symmetrical weakness. Okay. The missing point in the examination, the sensation. I don't know why you didn't touch the sensation
I
at all.
remember it when you asked me what is your diagnosis. I'm just
Yeah.
like, no, I did.
Okay,
Yeah.
at least when you do a focused examination to limb or to both limbs, like lower limb or upper limb, finish it at totally. Don't go to the upper limb. What the benefit of examining the upper limb?
You are right. Yeah.
So instead of that, you can do the lower limb sensation rather than doing the motor of the hands. What if you found the hand weak? Nothing. It's generalized weakness and uh, nothing will be different from the lower limb. But the sensation here is very important. What you expect in the sensation he might have?
Posterior,
Yes,
posterior sensory affection.
dorsal column. Yes, dorsal column.
Yeah.
So what will be impaired?
The position and vibration sense.
Perfect. Deep sensation. What
Yes.
if he has superficial sensation defect?
It might be um it might be nutritional from the because his diet is not that good.
Okay, and
Mm,
still he might have possibility of peripheral neuropathy, right?
yeah, okay.
It's associated, and also you can suspect diabetic neuropathy as well.
Diabetic neuropathy, yeah, from diabetes, yes.
So he might have all sensation modality affected.
Mm-hmm, mm-hmm.
Yeah. Apart from this, yes, no cure from the disease. Genetic counseling and counseling about the complication, screening for the HOCM and the diabetes if he has. You have to mention it as specific investigation. Okay. Yes. So the score will be for physical examination. I guess you get borderline. You didn't examine all things.
Mm-hmm.
The heart here, you missed the heart.
Yes.
However, you mentioned the pulse and the pulse character and the collapsibility, but still you didn't do the examination of the heart. At least to do detect the apex, and also you can just listen to any murmur. What if there is hokum? What the murmur will be there?
For Hocum, it might be ejection systolic murmur, systolic
Where?
in the aortic area.
Which
From
aortic area? There is two
uh,
aortic area. Which
yeah,
one?
yeah, 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 yeah. In the second aortic area.
Why?
Because it's aortic outlet from
Subaortic stenosis.
subaortic stenosis. Yeah.
Okay, and other murmur you might find.
The murmur of VSD. No, Hocum.
No, no,
Sorry, no, no, no. Yeah, what is the murmur? Again, I can find the systolic murmur in the same in aortic too as well.
regage. No, it's not regage. It's mitral regage. Mr. Sam Ash, you remember?
Uh-huh. Okay.
Mr. for MR, mitral regage,
Mm-hmm.
and Sam for anterior
Systolic. Mm.
of the leaflet for the mitrals, something of the valve placement. And the
Anterior motion.
last, yeah, anterior, this one, and thickening of the septal or thickening of the muscle. Which,
Mm.
okay, this is the case. And yeah, for the physical borderline, physical exam, identify finding, I will also give you borderline because you didn't pick up the sensation
Mm.
impairment. And for the clinical judgment, clinical communication, you did great. Yes, I can give you satisfactory clinical judgment as well. Satisfactory for the differential. Yeah, also you give me good differential. Again, the satisfactory and the welfare and concern. Okay, great, Dr. Najla. Any question?
No, thank
No
you.
worry, it's complicated case and difficult scenario, but at least now how to
It's
approach.
yeah, yeah. It's just a little strange to have it like a long case, but it's not an excuse.
Yeah, no excuse. You're right. Systolic anterior motion. Yes, I always forget this systolic anterior motion of the mitral valve. Systolic anterior motion. Thank you for reminding. I hope I will not forget it again. Okay. Yeah, well done. Yes, she did great. Genetic, not aortic regurg. It's this is another thing. Okay, how come mitral valve prolapse? No mitral valve prolapse here. Diabetes. Yes, well done. Recently approved FDA drug for cardiac ataxia. Omaveloxone. Okay, omaveloxone is a small molecular that target the NRF2 pathway, which plays. I don't know if the examiner knows about this medicine even. It reduces the oxidative damage, inflammation of the nerve system, thereby slowing disease progression. Okay, let's share it to the group also to be aware about. Yes, doctor, please, Dr. Fatma, you can share it to the group just to know and to be aware about it. Systolic anterior motion, yes. Well done, murmur. At the first second, no, it's second because it's subaortic. The first aortic area will be for the aortic stenosis or aortic sclerosis. But for the Friedreich, it's subaortic, so it will be in the second aortic area. Murmur, well done, yes. Okay. The differential, again, Friedreich ataxia on the top. You can mention subacute combined degeneration, but again, it's that you can say no cerebellar affection and Charcot-Marie-Tooth also as a familiar condition with peripheral neuropathy and weakness. Systolic murmur, not ejection in HOCM. Yes, systolic murmur in the second aortic. And mitral regurg murmur. Not radiated to the carotid, by the way. This is different from the aortic stenosis. Okay. Okay, Dr. Najla, or any question or any comment, please, before moving to the next scenario. Yes, but not ejection systolic murmur. Okay. But it's one of the differential of, yeah, it's one of the differential of ejection systolic murmur for aortic stenosis. Mr. Sorry, Mrs. Anita, 22, present with lower limb weakness. Okay, so the same topic.
I was afraid that you mean my case, but
Oh my
it
God.
was something different.
Oh my God.
So it is lower limb weakness day.
Okay.
Assalamu alaikum, Dr. Basu.
عليكم السلام دكتور ياسر. Yes.
In Frederick ataxia, there is a
Mhm.
plantar could be upgoing,
Yeah, it's upgoing some, yes, but yes, you're right.
But I
You might
believe
have,
I. Mm-hmm.
yeah, you might have it, yes, as extensor going or upgoing. Yes, you're right.
but you
It's
do
one
not
of the differential of upgoing
with multiple sclerosis, cervical
absent reflex. Yeah, with absent reflex upgoing.
with
Yes, you're right.
absent.
Yes, you're right.
So when you told plantars are downgoing, then I was first I was making this diagnosis of Frederick ataxia. Then you
But
told plantars are downgoing. Then I was confused.
yes,
Why
you're
is
right. But some, I think with peripheral neuropathy, it might be also downgoing or mute, right? So it's not necessary if there is peripheral neuropathy.
if there's a peripheral neuropathy, then it will be confusing.
Yeah. It should be spinocerebellar degeneration. It include all types. Dr. Ahmad Mansour. Yeah, there is spinocerebellar degeneration in this. And cerebellar syndrome, you should do all the syndrome or cerebellar symptoms, Dr. Najla. You
So
did, yeah, she
if we
did.
find Pescavus, two diagnoses should be in our mind. Either it is
Yes,
Charcot-Marie or
Or Frederick.
nephritic.
Yes.
yes, exactly. Yes, you're right.
But
If
there is
there's no,
cerebellar infection. That's why I'm just like.
yes, yes, it's a
I
cerebellar.
noticed the plantar as well, but I thought might be from the weakness
No,
to
no, no.
it to be affected or
Yeah, usually
prolonged weakness.
it will be like this. Yes, as upper or plantar.
Outgoing.
Yeah,
Outgoing.
dorsiflexion.
Mm.
Yes, you're right.
Is
Okay,
here the spastic paraparesis we can say in Frederick ataxia?
spastic.
Paraparesis may be there or not.
No, it's not spastic one because also there is cerebellum.
Cerebellum is involved in MS, but in MS there may be patient present with spastic
No, no, and
paraparesis.
this one also there is cerebellum. And Friedreich ataxia, it's called ataxia. Why he's having ataxia?
Because cerebellar ataxia.
No, no, there is spinocerebellar affection. Yes,
Yes, yes.
I will share it to the group also, the PDF from Bass Medicine as association. Okay,
Okay, okay.
could be MS. No, MS will be more toward spastic, and it will be on and off, like relapsing, remitting, most of cases. And also, you will see also of the phenomena for vision optic neuritis. But yeah, you're right. There is similarity. Optic neuritis also here. Yeah, you can think about it, but the difference will be for the spasticity. Here it's more floppy. No peripheral neuropathy in multiple yes, of course. But there is dorsal column affection, there is cerebellum, there is optic neuropathy. Sorry, optic neuritis. So it's possible, but against it, they no peripheral neuropathy and also no spastic paraparesis. Friedreich can cause spastic also. Thank you, Dr. Ayan. Yes. Okay. Spastic paraparesis. Multiple multiple sclerosis, spinal cord compression lesion, transverse myelitis, multiple sclerosis, Friedreich ataxia, both cerebellum and sensory ataxia. Yeah, so there is cerebellum both and sensory, Dr. Azhar.
Yes, yes.
Anyway, I brought this case just for learning to refresh this topic because we didn't practice it long time. What is the first and second aortic area? First aortic area in the right, second intercostal space, second aortic area in the left, third intercostal space below the pulmonary area. Okay, yeah. Yeah, thank you, Dr. Ayad. Thank you.
Dr. Boss,
Okay,
can you send it also in the group also?
what?
Common, this Dr. Ryan, he sent in the chat box.
Yes, I will. Okay. Okay, give me 2 minutes, Dr. Dr. Najla, then we'll start.
Take your time. It's okay.
Any question before moving from others? Okay, Dr. Najla, you ready?
Yeah.
Okay,
Yeah.
let's start.
Okay.
Hello, everyone. I'm Dr. Mukhtar, the doctor in the clinic today. You must be Mrs. Anita.
Yes, doctor.
You are 22 years.
Yes, doctor.
We are here to discuss about your health issue. That okay for you?
Yes, please, doctor.
Yeah, I will take some history notes, then I will examine you.
Okay.
Tell me, please, what bring you to the clinic today?
Uh, Doctor, I can't walk since today morning.
Okay, I'm so sorry to hear about that. So it started only for today,
Yes, doctor. Yeah.
and all of a sudden.
Yes.
Okay, and any previous attacks?
Um, Not really, doctor. I had such a thing before, but it's just was for a couple of hours and subsided.
It was when exactly it was?
It was maybe a year ago.
Okay, and are you diagnosed with any condition?
No, doctor.
Okay, and do you think is it floppy or stiffy?
Um, I just can't move them. I feel they are too heavy.
Okay, when you try to raise it up, do you think it's stiffy one?
No, it's just heavy. I can't move them. I can hold like
Okay,
I can just
and
hold them.
okay, and in both legs,
Yeah, both legs. Yeah.
do you think is it more towards your tummy or away from your tummy? The weakness?
I'm not sure, doctor.
Okay, how about the sensation over it? You feel it?
Yes.
You feel okay.
Yeah.
Any trauma to your back?
No, doctor.
Okay, and did you feel like, sorry for this, you lost the control over your water work or your back passage?
No, doctor. No.
Uh, how the sensation in the area between your legs? You feel it while going to the washroom?
Yes, doctor. I don't feel like there is any problem.
Okay, good.
Yeah. I'm not sure,
So
but yeah.
yeah, so in only weakness, no any sensation affection.
I know, doctor, but I feel like it's painful. My
There
legs
is
are
pain.
painful, kind of. Yeah, painful, achy,
Okay.
painful.
And do you think the weakness progress increase or same or on and off
Um,
when started?
I feel like it is the same since I wake up. Yeah.
Okay. And before that, what you were doing? Do you remember?
I just wake up like I can't move.
Okay. And before sleeping, did you eat a heavy meal?
Actually, doctor, it's not exactly. It was long time that I didn't went to the gym. And then I exercised a little more yesterday night and just came back. I ate a little and went to sleep.
Yeah, this meal was it carbohydrate, glucose, rich foods? Do you know?
It was a sandwich, doctor.
Okay. Okay. Apart from that, you have any loss of weight recently or before?
Yes, doctor. Yes, I noticed that. Yeah, my weight is. Yeah, I lost some weight.
Is
Yes.
it intentional?
No, not intentional at all.
How's your appetite?
It's good.
Okay. And do you feel any high body temperature?
Yes, I prefer. Yeah, I prefer. I prefer cold weather.
Okay. And any lumps or bumps in your body?
No, no, I didn't notice any.
Any night sweats?
Yes, sometimes.
Okay. Do you feel any lumps in front of your neck?
No, not at all.
Okay. Apart from that, you have any long-standing disease I should be aware of?
No, doctor. No,
Any surgery before?
no,
Any allergy to any medication?
and no, doctor.
You are taking any medication?
Yes, doctor. I have been started on a medicine for my heartbeat. I was noticing my heartbeat so fast, so I went to my GB and he prescribed a medicine to control it.
Okay. And how is it now?
I feel like I'm good. Yeah,
Do you remember the name of medication?
it's propranolol.
Okay.
Yeah.
And you are compliant to this medicine?
Yes, I'm taking. Yeah, I'm using it.
Okay. Did you add the dose or increase the dose recently?
No, doctor.
Any procedure?
No, doctor. But I'm waiting some blood test with my GB. He started the medicine and he took some blood test, and I'm waiting for the reports.
Okay. And do you think you are paler or anyone told you you are paler than before?
No, doctor.
Do you feel dizzy while standing from sitting position?
Not at all.
Any headache?
No.
Any blurring of vision?
No.
Any hearing problem?
No.
Any unsteadiness?
No, doctor.
Okay. Any difficult swallowing?
No.
Any short of breath?
No.
You told me about intolerance to the hot weather. When exactly started?
It's like I have been like this all the time, but maybe recently I feel it is getting more. Like for the last 5 months, maybe.
Okay. And do you have any chest pain along with the awareness of your heartbeat?
No, doctor. No.
And no cough?
No.
Coughing up blood?
No.
Okay. You told me you lost weight, right?
Yes, doctor.
Okay. Any tummy pain?
Not at all.
Any distension in your tummy?
Not at all.
Any change of your bowel habit?
Mm, yes. Sometimes, yeah, I had sometimes loose motions, but
And is
not recently.
yeah, can you describe it for me? Is it watery or bulky?
Um, it's it's not that watery. No, it's just loose motions. 3 to 4 times a day, and I will have like regular motions for few days, and again I may get. So it is not something steady.
Okay.
Mm-hmm.
Is it alternative with the hard stool?
No.
Okay. And is it flushable?
Yes.
Okay, good. How's your diet?
I feel like my appetite is good. I'm eating
Uh,
well.
and you are taking balanced diet, right?
Yes, yeah.
Okay, apart from this, you sorry for these questions. Do you have any change in your period?
Yes, I had my period stopped for some time. That's why I consulted my GB,
Mm-hmm.
and yeah, I'm awaiting for the blood reports.
Okay. What about birth control pills? Are you taking any of them?
No, doctor, no.
Any, are you pregnant by any chance?
No, doctor, no.
How's your water work?
It's fine.
No change. Any
Yes,
skin rash?
I know.
Any joint pain?
No.
Did you notice any skin change, the color?
No.
Do you feel thirsty?
No.
Okay, I might examine you, and while examining you, I might also ask you some questions. So I will start by the general look.
Mm-hmm.
How the look? She is cachectic, underweight,
No, it's just like no normal.
normal body weight, average body weight. Okay.
Yes. Mm-hmm.
I will ask for vital chart. Any surrounding before?
Say again.
Any surrounding? It's wheelchair.
Nothing. Nothing. No, nothing in
Okay.
particular. Yeah. So the blood pressure is 120/70. Her heart rate is 105. Respiratory rate is fine. Temperature okay, and saturation is fine.
Okay. Any change of blood pressure sitting and standing?
No change. No.
Any clubbing in the hand?
No clubbing.
Any other joint problem? Any darkening for the skin?
No.
Okay. I will ask for tremors. Does she have any fine tremors?
No.
Any flapping tremors?
No.
How's the pulse? Is it regular?
Yes, it is regular. 105.
And collapsibility? Any change
Not
of?
collapse. No, not collapsing.
I will look at the eye. Any
Mm-hmm.
change in her eyes, pallor or jaundice?
No pallor, no jaundice. No.
Any ptosis?
There is, yeah, some
Exophthalmos?
yes, some minimal, some exophthalmos, yeah.
So I will examine from the front from the back for exophthalmos and from the sides.
Mm-hmm.
I will offer acuity and
No. Mm-hmm.
normal, the
Yes.
fields
Normal.
and the H-shape movements. Any double or if you feel any double or pain, let me know.
No, I'm not seeing any doubles. No.
I will do the lid lag
A positive.
positive.
Mm-hmm.
Okay. I will offer for fundoscopy.
No need.
No need. I will ask her to take sip of water.
No enlargement.
No, and can you protrude your tongue out? Any swelling
Mm-hmm.
in front of her neck?
No.
I will examine for lymph node in the neck.
No, nothing.
I will stand behind and I will examine.
Uh,
Nothing.
no enlarged lymph nodes.
Okay, I will examine for the heart, quick examination, the apex beat, and any murmur, quick
It's
examination.
it's fine. 2 minutes
Fine.
remaining.
Okay, you have any family history?
Actually, I'm adopted, doctor.
Okay, and any travel recently?
No, no,
Do
no.
you smoke?
No.
Do you drink alcohol?
Yes, occasionally.
And less than the limit.
Yes, I'm not. Yeah, yeah, it's within
What's
the.
your job?
I'm a teacher, doctor.
And how the impact on your job?
Actually, yeah, I didn't attend the school today for short notice. I called them. And it's Monday now after the weekend.
You,
Yes.
we will give you sick leave, no worry.
Thank you very
Do you
much.
drive?
Yes.
And
I,
last thing, I will advise you to hold driving till we reach to the bottom of this problem. And I will examine quickly the legs for the power and the
mm-hmm.
one sensation superficial and for the deep one also.
Sensations are intact. Power reduced.
Okay, and the tone,
Hypotonia.
the reflexes.
Hyporeflexia.
Okay, what are your concerns, Anita?
I'm really worried, doctor. Am I turning paralyzed, or what's going on with me actually?
I appreciate your concern. It's no worry about that. It's a condition temporary, but once we control the main disease, it might be resolved. You have condition called thyrotoxic periodic paralysis. It's some disease running in family, and we can avoid this by certain instruction. You have other concern?
No, doctor, but how you gonna control it? Like I can't move.
Yeah. No worries, Mrs. Anit. We have
Anita. Mm-hmm.
Anita. Yes, we have some medicine for this condition. It might help to resolve the main disease, which is the thyroid gland in front of your neck.
Mm-hmm.
Although it's not swollen, however, whenever we control the symptoms, you might have less frequency of this weakness.
Mm-hmm. Mm-hmm. Mm-hmm.
You have another concern.
No, doctor, thank you.
Okay. Still 13 minutes, right?
Yes.
Well, it's 15 minutes, but you said 2 minutes left. Why? Anyway, this time I will do a lower limb examination.
Okay, you can continue. It's okay.
No, no,
Continue.
I'm
What
I'm done.
examination? What else you want like to do?
Yeah, I'm satisfied now with my examination because I will do, yes, the remaining lower limb examination, tone, power, reflex, coordination, sensation, and I will ask for the gait. So
Mm-hmm.
it's adequate enough to do it.
Mm-hmm.
It's for me, I'm satisfied. Okay, let's do the Viva
So present your
questions.
case.
Yes, Mrs. Anita. She is 20 years young female, came with weakness, started all of a sudden, couple of hours ago. She has no sensation affection. She is feeling floppy and hypotonic, hyporeflexic as well. The other sensation modality on examination were intact entirely. Apart from that, she had history of and features suggestive of thyrotoxicosis in the form of hot intolerance, along with diarrhea and amenorrhea. She had also some exophthalmos in her eyes and lid lag, and she has also palpitation. Putting all this together with adopted history, we can give her diagnosis of thyrotoxic periodic paralysis.
Okay. So what is your differential diagnosis?
Yes, we can think about hyperkalemic periodic paralysis, hypokalemic periodic paralysis as well,
Mm-hmm.
and we can think about conversion disorder.
Mm-hmm. Did you ask her about her mood?
Yeah, sorry, no,
Mm-hmm.
no.
Mm-hmm.
But supposed to ask about any stress and any mood change. Yes, you're right.
Mm-hmm. 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 What else?
What else as a differential?
Mm-hmm.
We can suspect myasthenia gravis as association with Graves' disease, but
Yes.
no other upper limb weakness or any weakness apart from hair legs.
Mm-hmm. Mm-hmm. Okay.
Any respiratory also system symptoms.
Mm-hmm. 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 Is Guillain-Barré one of your differentials?
Yes, Guillain-Barré yeah, could be a differential since she has weakness in the legs and areflexia. Yes, you're right.
Mm-hmm. 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 Okay. So what points in your history you would like would point you towards Guillain-Barré syndrome?
Yeah, any previous infection.
Mm-hmm.
Yeah, that's it. Or any attacks of fever or gastroenteritis. I mean, infection, the same question. Yes.
Mm-hmm. So how would you like to investigate this patient?
Yes, general investigation and specific investigation and bedside investigation.
Mm-hmm.
General investigation in the form of CBC and Ferenci markers, liver function, kidney function, test coagulation profile.
Mm-hmm.
Specific investigation for the disease, TSH, full thyroid function study,
Mm-hmm.
TSH, T3, and T4 anti-thyroid antibodies like the anti-TPO and anti-thyroid stimulating hormone antibodies.
Mm-hmm.
Apart from that, specific investigation for the weakness, neurophysiological study like nerve conduction study. However, everything will be normal in the neurophysiological study, mostly.
Mm-hmm. 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 Okay. 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 Oh, you mentioned that. Okay. So how you will
Yeah,
measure the
ECG
patient?
as well. Also, I could do ECG and echo as a bedside test.
What you would like to see in the ECG?
Yeah, any change in pulse, irregularity, tachycardia. Yes.
Mm-hmm. Mm-hmm. Okay. In the ECG, we would like to look for the signs of hypokalemia in the ECG. Okay. So, hello?
Okay.
Are you?
Okay. Yes. Yes. Go
Okay.
ahead. Yes.
Yeah. Okay. So how would you like to manage this patient?
Yes, after counseling, education about the condition and the complication association, and according to the multidisciplinary team approach, we can call for endocrinologist, physiotherapist, and ophthalmologist, and genetic counselor team, physiotherapist,
Mm-hmm.
specialized nurse.
Mm-hmm.
After confirming the diagnosis, I could start her on anti-thyroid medication.
Okay.
Instruction about also eye manifestation of Graves,
Mm-hmm.
just to be careful about and for precautions.
Okay. Okay. Is there any pharmacological treatment for this case other than the treatment of
Yes,
cytotoxicosis?
we continue on her on propranolol as she started,
Mm-hmm.
and thyroid medication, carbimazole mostly.
Mm-hmm.
And for the condition, I can give her a steroid. Sorry, not steroid. It's potassium sparing diuretics
Mm-hmm.
to improve her potassium and potassium supplements along with some vitamins
Mm-hmm.
supplements.
Mm-hmm. Mm-hmm. Are you
Yes.
aware of any other medicine can help in this condition?
I think acetazolamide
Yes, yeah,
can help.
acetazolamide can help in her condition.
Yes.
Okay, okay. There is a specific test for to confirm the periodic paralysis. Are you aware of such a test, like
Periodic.
hypokalemic periodic paralysis per se?
Uh, I'm not sure. Genetic, I mean, you mean? I don't know.
No, 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 no. Mm-hmm, mm-hmm. Okay.
Channels, am I calcium channels, something like that? I'm not sure.
Mm-hmm, mm-hmm. Okay. The time for five questions is 6 minutes. Yeah,
No, no, five.
5 minutes.
What happened to your timer?
My timer is just like all over the place.
No problem.
Yeah.
It's 5 minutes and 15 minutes. Okay.
50 minutes, yeah. Okay, so yeah, you did very well, and you got the disease. I thought I tried to make it a little difficult for you, but this
Yes.
patient, her symptoms are controlled with the propranolol, so she's not showing like typical symptoms of cytotoxicosis. Yeah, you got it. It is transient periodic paralysis. I believe you covered everything in the history, but I believe we need to put Guillain-Barré syndrome as a differential as well. Just a few questions in the history. Yes, in the acute phase, we need to give potassium supplements, and yes, acetazolamide is one of the medications that can help with this condition, along with treating cytotoxicosis. The specific test, there is a specific test called provocative test, provocative test, provocative test, which is simply giving the patient glucose and waiting for the response in the EMG.
Okay. Yeah.
Yeah, yeah. Previously they were doing muscle biopsy, but now not usually done. Other than that, yeah, it is nerve conduction studies and EMG as you mentioned, and yeah, you mentioned all the tests. The creatine phosphokinase will be low in those patients. Other than that, I believe you covered everything.
Okay. Thank you, Dr. Najla, for the case.
You are welcome.
Nice case with nice presentation. Yes.
You are welcome.
Okay. Any question
ما
from
تقفل
you?
البلكونة دي
Doctor,
تمشي دي ولا لا؟
Yes. Sorry.
regarding the thyroid examination, maybe I did not hear you did the auscultation and percussion.
No, but there is no goiter. I skipped for that reason.
There was no goiter.
Yeah, there was no goiter. Yes, she said that. I asked her any swelling. No, she said no. And I tried to palpate, but nothing was there. Yeah, suppose if there is goiter, I could do. But you're right. Also, I have to offer for retrocessional extension percussion along with the
Eh?
also auscultation for Berui. Yes, you're right.
And if there is a goiter in the history, three questions, very important.
Dysphagia, yeah, dysphagia and dysphonia and short of breath and stridor. Not
Okay.
stridor, hoarseness of voice, yes.
And what is the rate of infusion of potassium in hypokalemic periodic paralysis?
Yes, if severe, you can give up to 20 millimole per hour in the central line. But if mild, we can
I
inject,
think
yeah.
10 milliequivalent per hour.
This is 10 peripherally, but for center line, you can give up to 20. But 10, yes, the maximum, because the patient, if asymptomatic or less symptomatic, I mean, or not EC with ECG or not arrhythmia. If there is arrhythmia, it's indication for high and rapid correction by inserting center line and proceeding with uh, high dose 20 millimole per hour.
Oh, okay. Thank you. Mashallah, you did very well. Both of scenarios, they were very good scenarios.
Thank you, Dr. Azari. Thank you so much. And any comment from other, any question?
But the problem is, okay, we are doing here an examination. Can we finish the examination in the exam? We are saying I will do tone, power, reflexes in 1 minute. Can we do it in exam in one
Yeah,
minute?
I will tell you now. The time wasted for the question online will be saved in the online questioning. So you'll have good time. You got
Yes.
it?
No, no, sorry. What did you say?
The time wasted while asking her in the online session. She's replying after I finish the question, so it takes time. In the online setting, if you sit with someone and ask him in the same conversation, you will save a lot of time. You got it?
Yes, 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 yes.
Yeah, so at least whenever you suggest or you catch the case, start examination. I thought
Yeah,
it's
yeah.
15 minutes as Dr. Najla said, but I found still 2 minutes there, which is something good.
Yes, yes.
Yeah, so for me, I prefer to jump to the examination, and after finishing the target examination, you can ask the small question for social and occupational.
I
I
like this
wish,
separate,
yeah.
epic case was very nice because usually it is a short case, but you brought it in the as a long case. It was very good learning because it may come as a long case.
Yes, yeah, of course.
You see, if you are sitting in the exam, the patient they have covered the feet of the patient in the exam,
Yes, they cover everything.
so we cannot say please expose it from the start.
You can ask to explore the legs before the history, or you can ask to do it later on. What you mean?
Because
You mean he's covered?
yeah, yes, maybe
You
his
can ask him before going to him, please, can you unwear your t-shirt, unwear your pants, whatever he's wearing.
likewise if we see a pest cavus, then immediately we can catch the diagnosis whether it may be Charcot
Yes,
or
yes.
it may be
I
Frederick.
prefer to have a look before
Yes,
sitting. Or at least you can start history whenever you catch, you can go to the patient, have a look, and you can go back to ask for the social and occupational. This is what I prefer. But be sure, whenever you jump to the patient, the examiner will come after you. So finish the past medical history, the system review, and the constitutional, and do your examination. Once you get the case, don't waste the time asking for the history because you will find a lot of things in the examination. Try to pick all of these things. As I said before, it's 8 marks. Physical examination, identify finding. 8 marks might put you up, and if you lost them, you might fail the station because of this examination. The same for the advice for the concern. Whenever you hear 2 minutes left, ask for the concern. Okay.
yes. Acha, on the history, Charcot Marie and the Frederick ataxia, the differentiating point, I think it will be cerebellar because dorsal
Yes.
column will be in both will be involved, but in Frederick ataxia, cerebellum is involved. So in history, it is very important, and examination also is it's very
Yes,
important.
yes, I agree 100%. Yes.
Very nice case. Very nice case.
Thank you, Dr. Azar. Thank you always for your comment. Any question or comment else? There is some chat message. I thought we are 13 minutes. It's okay. Better to practice on 13 minutes, Dr. Najla. It's okay. Never mind at all. Better to finish earlier than the exam. Because in the exam, the time will be waste. As I said, you will take longer time for the all steps. As Dr. Azhar said, when you do, can I do tone power reflex? It's not like magic. I finish all of them in second. No, you will do time at least 30 seconds for the tone, 30 seconds for the power, 30 seconds for the reflexes, 30 seconds for coordination, or 15 seconds for coordination, and for the gate as well. So better to finish all this early.
Yes, right.
Yeah.
I think we should make a habit. When the 8 minutes pass, we should one
Yeah,
one can
but
say
no one will remind you by the time for the by the way.
no, no, no,
It's
no. You are
your
right. But in the exam, no one will remind. But here we will say that 8 minutes pass. So you should please you will short your history. I think we should
yeah,
have a habit.
this is what I
Sometimes.
prefer. Take
Uh,
history, constitutional and past medical history and surgery. Mostly you will get the case.
yes, yes,
After
yes,
that, do examination. The family history you can ask why after the examination or even while standing. The travel, the occupational, the smoking, the alcohol, the job, driving. Okay, so you can do it after you finish examination or before the concern. Okay, but
before this new setup, there was only 10 minutes. So how the history was completed in a history examination in
what
yoga
you
was
mean
given
before?
before,
Sorry, what you said, Dr. Azhar? Before you mean?
before before last year, yani 1 year before or 2 year
Yeah, yeah,
before,
yeah. It, but no history was taken.
only 2 3 minutes history you are taking bus.
No, no. There was two station. One for history taking. It was 14 minutes, I guess.
Yes, yes,
And the
yes,
other
yes.
one, 8 minutes, just for examination. You will go to the patient, examine him. No history.
No history.
Yeah,
Was
I
only
remember
examination.
that. Yeah, only examining for example, patient with hyperthyroidism like this, you will examine the steps of thyroid. And it was two stations like this, 8 minutes,
Yes,
8 minutes.
yes,
But I think the new format is better than before.
yes, yes.
Okay, thank you, Clauser, again. Any question? Any other question? Let me read the comments. Long PR interval, peak PR wave, flat T or inverted. Dr. Rodas, ST depression and U wave. Yes. ECG loop test. Also long QT. Yes, you mentioned long QT. Yes. Weakness distribution. Yeah, suppose if I will do examination, of course, I will do the proximal and distal. This is the steps of examination for the power, I mean. Thyrotoxicosis, thyrotoxic assay, okay, hypokalemic periodic paralysis. Okay, thank you, everyone. Anyone has a question, having question, please, before ending the session? Any question? Any comment? All satisfied? So we can thank Dr. Najla for the practice today. All of you, thank you for your attendance. Wish you the best. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum assalam wa rahmatullah. Thank you very much.
Thank you, Dr. Najla. Thank you.